Hey, welcome! It's Ashley from Demystifying Your Health. Today, we're going to be talking about diabetes. Almost everyone has heard of the word diabetes, but they just don't realize the exact impact it actually has on the daily life of the people who have to live with it. There are two main types. There's diabetes mellitus, which is broken down into type 1, type 2, and gestational, and these have to do with your body's ability to produce insulin or use insulin. Diabetes insipidus is to do with how your body regulates fluid volume, and while the two present very similarly, they're actually very different. Today we're going to be going more in depth about diabetes mellitus and all of the categories underneath that. Let's get started. Type 1 and type 2 diabetes are caused by two factors. First, you have to inherit a predisposition for the disorder, and then something has to trigger it. In type 1, you inherit the risk factors from both parents. Usually they're not diabetic. And then something, most often as a child, in the environment triggers that to start. It causes your body to not be able to produce enough insulin. This is why it's called insulin deficiency. In type 2, your body is unable to use the insulin that it produces, which is why it's known as insulin resistance. Insulin is vital to our survival. It helps glucose, which our body uses for energy, to get from our bloodstream into our cells. Type 2 is directly related to obesity, which is the result of poor eating habits and lack of physical activity. Type 1 used to be called juvenile diabetes, whereas type 2 used to be called adult onset diabetes. Unfortunately, in recent years, with the rise in obesity, the number of children being diagnosed with type 2 is also increasing rapidly. Gestational diabetes occurs around the 24th week of pregnancy, and while the exact cause is not known, it's thought to be related to the hormones produced by the placenta. The thought is the hormones actually block the mother's body's ability to get glucose from the bloodstream into her cells. In this regard, it's very similar to type 2 diabetes. It's important to note that just because a woman has gestational diabetes doesn't mean she had diabetes before, nor will she have diabetes after her pregnancy. But it does need to be addressed during because it can be very harmful to both the mother and the baby. A different subset is also called prediabetes, and this can occur in any individual. And this is when blood glucose levels are elevated, but not high enough to be considered full-on diabetes. Diabetic symptoms are often mild and go unnoticed. They can include frequent urination, feeling thirsty, feeling hungry even though you're eating, fatigue, blurry vision, cuts or bruises that heal slowly, weight loss if you have type 1, tingling, pain, or numbness in your hands or feet if you have type 2. For women with gestational diabetes, they often have no symptoms, which is why all women should be screened around the 24th week of pregnancy. If diabetes is left untreated, it can cause numerous and severe complications, which can include neuropathy, which is numbness to your hands and feet, which means that you don't feel if you injure them, kidney disease, stroke, high blood pressure, DKA, which is diabetic ketoacidosis. In addition to having the generalized symptoms, people with DKA will also have nausea, vomiting, dry, flushed skin, a fruity smelling breath, and difficulty breathing. And then HHNS, which is hyperosmolar, hyperglycemic, non-ketotic syndrome, which will also have the generalized diabetic symptoms, but they will have a high fever that's above 101 degrees Fahrenheit, hallucinations, weakness on one side of their body, and their blood sugar level will be over 600. With any of these complications, it's important to be seen by a doctor. For DKA or HHNS, you should be seen at the emergency room because these are life-threatening situations. If your doctor thinks that you have diabetes, the first thing they're going to do is do a finger stick and check your blood glucose level. This gives them an accurate picture of, in the moment, what your blood sugar is. If this number comes back high, they're going to order one of 3 types of tests. The first is the A1C or HbA1c. This measures your average blood glucose level for the past 2 to 3 months. It doesn't require any fasting or anything else. If your A1C is normal, it will be under 5.7%. If you have prediabetes, it will be between 5.7 to 6.4%. If you have diabetes, it will be at or greater than 6.5%. The next type of test is the fasting plasma glucose, or FPG test, and this looks at a fasting blood glucose level. What this means is you're not allowed to have anything to eat or drink except water for 8 hours prior to having the test done. If this is normal, it should be under 100. If you have prediabetes, it will be between 100 to 125. If you have diabetes, it will be at or above 126. The last type of test is the OGTT, or oral glucose tolerance test, and this checks your blood glucose levels before you take a sweet drink in, and then 2 hours after you ingest that sweet drink. If it is normal, it will be under 140. If you have prediabetes, it will be at 140 to 199, and if you have diabetes, it will be at or above 200. When it comes to preventing diabetes, there are several things to consider. The first is to maintain an appropriate weight. To do this, you should eat healthy and be physically active. It's also important to not smoke and keep your cholesterol and blood pressure in check. It's also a good idea to be aware of your genetic risk for developing diabetes. If you have any concerns about any of these or questions, you should talk to your doctor. Diabetes is a lifelong illness that can have serious impact on your health. This is why maintaining control of it, or if possible preventing it, is so key. Stay healthy.